Give me 1 second. I gotta find an email. Hang on.
There you go.
Perfect. Hi, everyone. This is Corinne Gabbert. I am with the Southeast South Dakota AHEC, and I've got my colleague Michaela Titus on as well. Michaela, you want to say hi quick?
Yeah. Hello, everyone.
She's up in Aberdeen. We're excited to have you on tonight for our CHW and back to school conversation, as well as having you kick off the fall semester in the 2022-23 school year with us. A few little housekeeping items. You should have received our fall newsletter that we sent, I believe, about a week and a half, 2 weeks ago. Just a couple updates. If you have not already signed up for our Learning to Lead event, it's our student leadership workshop. We have worked on this over the past, I'd say almost a year and a half, with Northeast AHEC, Southeast AHEC, and in collaboration with Avera to develop a day-long curriculum to really highlight leadership, professionalism, communication, conceptualization, basically a one-day intensive on leadership for health profession students to kind of get you integrated and give you a better idea of what you might experience and give you some tools and resources as well that you can implement in your future careers. Whether you want to be a CEO, a nurse lead, a team lead, or you would rather just be the potluck king and sign everybody up for a potluck on a Friday. We've got unsung heroes as well within that leadership role. We do ask that you register. We are hosting this event on October 1st, so in just about a week and a half, up in Sioux Falls at the Sanford School of Medicine campus. It's at the Wagner Health Science Library. Registration is in this newsletter, and if you have any questions, please feel free to email Michaela and myself. We are looking to do another leadership webinar in the spring and hopefully have this Learning to Lead event again next fall, but we're still exploring some of those options. If you do attend, we know didactic hours are really hard to get with our scholars. We're offering 20 hours of didactic education, which is pretty awesome. Michaela said, let's give them 20 instead of 10. And I was like, okay, let's do that. You guys deserve a little extra help on our end. The next thing, obviously, you know about our scholar sessions. We are working on community health workers and going to be learning from one of my good friends, Angela Landine, here in just a few minutes. But we did want to include our next kind of upcoming scholar sessions, both for this fall and this spring. I will let you know our March date is tentative, just because it's kind of spring break and March in the AHEC world gets a little crazy. So to let you know, that's a little tentative, but we do hope you join us. They will be, Michaela, what did we decide? Third Wednesday of the month at 7 p.m. I think that's what we decided. So if I'm incorrect,
so yeah,
let me know if these dates aren't. Well, it's not February 22nd, 2022. I can tell you that. So these are all 2023. That's an error on my end. I do apologize. We'll correct that when we send out a newsletter in the fall or the winter, whenever we'll send it, the end of the semester. Last little reminders, please submit your hours. I am trying to update hours at least twice a month, but if you have a question or you would like your worksheet or your spreadsheet of all of your hours, feel free to shoot me an email. I'd be happy to get you that resource as well. And then Michaela has a couple things here with our student leadership experience. She's been working with her colleagues up in the Northeast AHEC area to identify certain areas for scholars to shadow, whether it's with HR, CEO, pharmacy lead, some of those different opportunities. So if you're interested in potentially gaining a different experience, specifically in rural communities, please let her know. These are new and we do ask for your patience as we try to coordinate those, but you can email Michaela and she'll have some more information with that. Michaela, is there anything you want to add about student leadership experiences?
Nope, I think you covered it.
Perfect. Well, then I will turn it over to my former colleague, Miss Angela Landine. She and I taught at USD together within the School of Health Sciences. She is my public health guru who I talk to about anything HRSA related. She worked with HRSA. We've talked CDC. She knows AHEC pretty well, which is fantastic from our end. But she's here tonight to talk specifically about community health workers in South Dakota. And she's are you the instructor or the chair?
I'm the chair of the department.
Awesome. So she's up at Southeast Tech now up in Sioux Falls doing the community health worker certificate program. So Angela, I will turn it over to you. I'll probably be off screen, but if you need something, I'll just be
Okay.
right here.
Okay,
And
no problem.
I appreciate you being here with us.
Yes, of course.
Thank you.
So why don't you guys, your students that are on there, if you wouldn't mind kind of giving me an overview of where you're at in your education level, and maybe your interest also.
Okay.
And I'm
Jocelyn,
gonna-
do you want
Yeah,
to
and
start?
I'm picking on Jocelyn because I see her on the camera.
Do you just want
Hello.
to do your program and how far along you
Yeah.
are?
Yep, you can have one of those. Sorry.
You're fine.
I told her I have a meeting and she wanted to sit. So,
No, she can sit. It's totally informal. You'll probably
Yeah.
see a cat or two jumping into the screen. They're like clawing at the door to get in my office.
do you want to say hi now? I'm a
Yes, hi,
senior.
sweetie.
Can you say
Awesome.
hi?
You go to school with mommy.
Mm.
And Jocelyn, remind us what school and what program you're in.
Presentation. I'm a senior at in the nursing program, and I actually just had an interview today for a clinic position in Aberdeen. So
Good, excellent. I will tell you, my mom actually is from kind of the Butler, Bristol area. I grew up in Wisconsin,
Oh.
but my mom's from South Dakota. And she got her nursing, her BS degree at Presentation, and then actually came back for a few years and was the dean of nursing there in the 90s.
oh, cool.
So
That's
yes, I
awesome.
know all about Presentation College. Yes.
Yeah, I want to go back for my my DNP someday. Oh, there you
Yeah,
go.
definitely. Yeah. And she went back and got like a PhD, but then she did nurse practitioner. So, you know, there's so many options for you in nursing.
Yeah, I
Okay,
really
good.
want to specialize in wounds. I think they're just so cool.
Yes, yes, good, good. We
Awesome.
need more nurses. Good, thank you.
Thanks,
And then-
Jocelyn. Kyle, I'll let you go next, if you don't mind.
Yeah, I'm a pharmacy student, my third
Okay.
year at South
Perfect.
Dakota State. I
Awesome.
have a year in this year left, so
Okay, okay. And then I will tell you another thing. I used to work for the College of Pharmacy at SDSU on a contract for
Mhm.
2 years with Dr. Hedge and Dr. Katz, who was there back in the
Mhm.
2010s or so. So I know a lot of the pharmacists over there at SDSU, great program. And I was working on all of the continuing education to get all kinds of programming in for the state. So I know that program very well too. Excellent.
Awesome. And last but not least, Lillian, do you mind sharing about yourself? She might be on mute. That's okay. We can, if you hop on, awesome.
Yes.
If not, I know
Okay.
sometimes being on a
So
phone.
that
with
helps me kind of get an overview
Yep.
of.
And we
who we're
also,
talking to.
Angela, have we have nursing, PT, OT, pharmacy, med, PA, med lab science. We have quite a diverse group of students
Okay.
within our program that will watch this.
Okay, so then, also then, are you guys receiving funding? Obviously, you're getting some type of stipend from AHAC for being an
So
AHAC
we
scholar.
actually don't give like full-on stipends.
Okay,
Some of these guys may know, but when they graduate, we do give them like a few extra like Amazon gift cards and promo items and those things.
Okay.
When we do our drawings throughout the year, we do kind of like incentives. So they have opportunities to get like $100 gift cards, or Michaela had Apple AirPods. I've got Bluetooth speakers, some of those things.
okay,
We don't get enough money in our HRSA grants between the two of us to
yeah,
do stipends. So we
Okay.
would love to. We don't have the funds to.
okay.
So they
Okay.
are doing this out of the goodness of their hearts.
Yes, no, I think it's great. And I will tell you, I'm gonna kind of give, before we even get into CHW, I'm gonna kind of give you my spiel, because
Sure.
I think as students, it's good to know how many different avenues you can go down
Mhm.
and how many kind of convoluted paths you could go down to get
Yep.
experience to be where you are. So, and I had mentioned this before, but my dad was in the military, so we moved around quite a bit, but I would say I grew up in Wisconsin. So I graduated high school from Wisconsin. My dad was in the military, and that's why I grew up kind of living all over the place as a child, but I went right into the Army. And that's kind of my family's group, is the Army, not Navy, anything else, but the Army. I was a medic in the Army, and I was in full-time Army. So I was at Fort Drum, New York, which is the 10th Mountain Division, way upstate New York, as a combat medic. In the summer, I would go to West Point Academy, which is the kind of the college for the Army. And we would teach first-year cadets battlefield first aid. So we would go up on top of a mountain and make kind of an obstacle course of all of these different first aid stations, like sucking chest wound, how to deal with a head injury, doing tourniquets, and just kind of that kind of thing you would see on a battlefield. So from that Army experience, I was like ready to go to college, went to college, got a degree in biology. And I also got a degree, biology and chemistry. And I also got a degree in marketing and kind of like commercial art. And my dad had told me, have something and then have plan B, something to fall back on. Because if you're not going to get a job in the sciences, you'll be able to get a job in the creative field. And I will tell you, my first job right out of college was working in a hospital, a huge health system, where I worked in the marketing department doing all of the health education material. So right away, my two experiences melded together perfectly. And from there, I moved to Utah, and I worked for the Olympics in the 2002 Olympics. And that was a great job, but also in the creative field, but doing a lot of the health and wellness. I work for a company also in Utah that makes all of the fitness equipment. So like Weider, Proform, Nordic Track, all of the treadmills, all of the weight systems. So we would go around the United States, and we were all personal trainer certified. So we all got personal trainer certified. And again, in the marketing department, we would go around the United States and train people that were selling our equipment at like Gart Sports, Big Five was one of them. Back in the day, it was like Sears and all of these big sporting equipments like Shields. So we would go in and teach the associates all about cardiovascular exercise and aerobic and anaerobic exercise so they could sell our equipment. From there, I went in and got my master's degree in public health and kind of really focused on public health and education. I started out looking at ATOD, which is alcohol, tobacco, and drugs, because I was working with athletes that I had met during the Olympics that were young people, like, 15, 16, 17 years old, looking to get into professional sports, Olympic level sports. And my thesis was all about talking to these young athletes about doping, and doping was just becoming big, performance enhancing drugs. And kind of, was like, hey, do you think it's okay to dope to be able to get a gold medal? And it was interesting that between their intrinsic and extrinsic motivations, they decided if doping was okay and they would take performance enhancing, or if they thought that that was unfair and they needed an even playing field. I never even worked in alcohol, tobacco, and drug. Went straight from Utah, came to Pierre, of all places. We ended up in Pierre. My husband got the job first, and I started doing contract work for the State Department of Health and then also for SDSU. So I was doing all kinds of different CDC contracts within public health. Did that for many, many years. Also got into another contract where I did just hazard mitigation plans for counties, FEMA plans, school operation plans for emergencies. So you can see I'm kind of all over the place in different kind of sectors within public health and healthcare. And then I had an opportunity to either go to CDC in Atlanta or HRSA in Maryland. And we were just kind of those people that like to move around and experience new things. So we went to HRSA. I didn't want to go to Atlanta because I'm a northern girl and I can't stand the heat. I hate the heat. So we went to HRSA because I thought it would be better, but it was just as hot because it's super muggy in the summer. And working for HRSA, I worked with all the people that did the community healthcare centers, the people who were overseeing the AHEC. The gal that ran the AHEC program was just down the hallway from me where I was. I was overseeing the public health training centers. So I did that for about 4 years, and we were kind of like, I don't know if we want to live in Maryland. It's too expensive. Let's kind of go back to the Midwest, get closer to Iowa, Minnesota. My husband's from Iowa, let's kind of land here. So we ended up coming back and landing in Sioux Falls and started working at University of South Dakota, teaching public health and epidemiology. From there, I worked there for 6 years, and that's where I met Corinne. And then from that kind of teaching gig, I got involved in the state community health worker program. We had already funding coming from CDC back in like 2015, 2016. We were already starting to see that CDC was really pushing this community health worker, initiative. And the idea being that we have so many people that need so much care, and especially in a rural state that we're in, we need those community healthcare workers because we don't have enough nurses. We don't have enough PAs. We don't have enough nurse practitioners. We don't have enough doctors. We need kind of those people that are going to be that bridge between the community members and healthcare and public health and human services. And then this kind of opened up where Southeast Technical College started a new certificate program to train new CHWs. And I was like, I'm out of here. I'm sick of driving from Sioux Falls to Vermilion 3 times a week. And so I gave it up, and I couldn't afford the gas anymore. So I'm glad I left driving to Vermilion, though I do miss my colleagues and I miss the students. And actually, I'll get to see Corinne's husband, who's in PA school next month, because I come back and I talk about public health and stuff. So all of that, what I'm saying to you is, my whole spiel is, even if you try to get into a field and you might not be successful, and maybe you don't get into PA school, or you don't get into OT school or PT school, do not fret. There are other avenues to get in, and you might just need to gather a little bit more experience and kind of go through it through the back door. Okay. And I always would say, have a plan A and have a plan B, and maybe even a plan C, but you'll get to where you need to go. Don't get frustrated, because as you can tell, I was all over the place and landed where I am now. Okay. Any questions so far? Okay, I'm going to share my screen.
And Angela, while you're pulling up your presentation,
Yeah.
I just want to reiterate to the students that are watching this that we all have unique backgrounds, and it's also important to realize you will be working with people from different backgrounds as well as different careers. I know IPE is something that's pushed on everyone, especially within the school system. But with CHWs, they're community health workers. And like Angela said, they need to be integrated in the community. And I'm sure you'll mention this too, but they are someone who can be an excellent resource for you when you are practicing in your community and you need extra care. So this presentation really is about connections, community, and how we can help support you as the providers or the practitioners, and vice versa. So Angela, I'll let you go along.
Okay, can you see my screen?
Yes.
Okay, perfect. So CHWs, some people will kind of call it community healthcare workers. It's not healthcare, they're community health workers. So really the whole profession, if you haven't heard of CHWs before, the whole profession started, especially on the reservations with tribal nations. And I was saying this to Corinne, about 50 years ago. They have been integrated into that tribal community for a long time. They've also been integrated into communities and other global health views. Not so much in the United States, though in some states they have been there, California, Arizona, Florida. There's some other states that have incorporated community health workers. And what I like to call them is the bridge. Like I'd said, they are the bridge between the community. And the community doesn't have to just be a zip code or a town. The community could be HIV patients. The community could be Sudanese immigrants. The community could be emergency medicine. So there are CHWs right now that are being trained, and we just started this new certificate program so they can get certified and then go back into the workplace. I have 18 already. We just started this in July this year. I've got 18 students. I got them from Avera. I have people from Monument Health out West River. I have people from community healthcare centers. I have people from community-based organizations. So they are in clinical world and they're fixed into the community and different kind of human services roles. They are that person when you as a provider provide a plan to your patient. You cannot possibly go and follow up with that patient on a weekly basis. You kind of say, hey, you should do this, lose some weight, stop eating so poorly, stop drinking, stop smoking, follow your A1C and your blood glucose, and I'll see you at your next appointment. The CHW is that person who is going to follow up with your patients to make sure that they're following their care plan that the practitioner has given them. And that just seems super easy, but it's not. And I'll give you some other examples of some things that CHWs do. But in a nutshell, they are really that bridge between public community health and human services and the healthcare world. So we've called them different names. And like I said, in some places they've been around forever. We have them in the Hispanic population. They're called promotores de salud. They are the street outreach worker, the person that might be talking to the prostitutes on the street, trying to get them in so they get STD and STI checked. That's their community. They are the family health advocate. They could be your home health person coming to visit people, maybe elderly people who are on home care. They're going to help navigate the system. I am very deep right now into healthcare systems. They need to know what the healthcare system is, and we are going through every bit of Medicare, Medicaid, health insurance, so they are able to tell their clients, we more or less kind of call them clients with community health workers, to help them navigate the system. Health insurance is not easy. And to try and describe Medicare and Medicaid to people who have no idea, who are really kind of health illiterate or are English second language, it's impossible. So they have to know the ins and outs of it and to be able to describe that to their client so they get into the right type of system that they need to be. They also advocate. They might be people that build capacity in their community, pulling some assessments together, being on a community health assessment and being able to maybe make some new programs, maybe write some new grants. They're kind of the quasi everything that doesn't fit into the health department or the hospital. So there's, again, some of their roles that they go through. You know, and I think my students are kind of like, oh my gosh, this is so much work. And it is going to be a lot of work for them right now. And if you guys think that you're busy right now, I have them in one semester. They are taking 4 classes, 4 of my classes, which I'm not the easiest. They're taking 4 classes right now. Plus, some of them have to take an English class because a lot of them are South Sudanese or Ethiopian because we need them to work in those communities. So they don't have the credits that transferred to the American school system. So they're even taking English. They're taking those classes for 8 weeks. And then the last 8 weeks of the semester, they've got to take 2 more classes. So if you guys think you're busy, believe me, these guys are really busy and their heads are spinning right now. Okay, so again, some of the core competencies. They need to be able to be really Wonder Women and Wonder Men. They got to have good communication skills. They have to be able to build relationships with people. If you're not a people person, don't apply. You should probably not be a CHW. Head into research so you can look in a microscope, because this is what we need out of these CHWs. We need people to feel comfortable with them. They're able to care and kind of bring empathy to these people in their situations and then guide them in decision-making. Again, service coordination, navigating the system. The system isn't easy. And you are learning this. It's crazy convoluted system. Advocacy, teaching. They're doing a lot of health education. I'm teaching them about how to build the right PSAs and the right, social media that they need to do, but then also be able to do motivational interviewing with their clients, being able to kind of pull things out that the client will need while still having kind of that sociology, social work component with them. All right. So I will go past this code of ethics here. Let's kind of get into the workforce development. Now, as Corinne had said, hopefully you will be working with these CHWs. Now, right now, I will tell you that Sanford, I don't have any Sanford students right now. I have 11 of them from Avera. Sanford was kind of in the last semester and they went up to Lake area. But we have the health systems who are employing these community health workers. They're putting them in their behavioral health. They're putting them in the clinics. They're putting them in rehab. They're putting them in home health. And then they're also having them be into the community-based health. So the health systems, the hospitals are totally getting it, that our doctors and our nurses and our OTs, PTs, our practitioners, pharmacists can't be with these people 24/7, but we still need them to keep on track of what they should be doing to take care of their health. That's where that community health worker is kind of picking up that gap. We're also going to have some at the community healthcare clinic, Falls Community Health, next semester. They're actually, they got a grant. If anybody's been down at Falls Community Health, you should go. It's also funded by HRSA, which funds the AHAC. And they are kind of rebuilding their area and going to have 2 CHWs right out front to be able to help the population, the underserved minority population that Falls Community Health sees. A lot of these people are on Medicaid, to be able to connect them. Hey, you don't have heat in the winter, we can connect you to a service that will give you heat or be able to get that at a reduced cost. Hey, you're coming from an abusive family, we can get you into a shelter with your child. Every little thing that they would need, there are services for. People just don't know how to connect to them. That's the job of that community health worker, kind of to pick up the slack of all of those little things that somebody can get into. All right, so I show you this map, and if you know your geography, what state are we missing? What state is in white?
The good old state of South Dakota.
Yes, yes. And I keep this on here because it's very interesting. We were one of the last states, South Dakota, and we're last in a lot of stuff. Though we do have a really good smoking cessation program at the state, and we're kind of #1 on that. And we're also #1 on flu vaccines. Our population gets flu vaccines every year at a higher rate than anybody else. So good job for us. We're #1 in a few things. So I keep this on here to show you we were the last state pretty much to be able to get into the CHW work. But why I tell you this is because we got into it so late, kind of in 2015, 2016, but we took off. And we were one of the first 3 states to actually, out of everybody else who had been doing this for decades, we were one of the first 3 states to be able to get Medicaid, the State Department of Social Services, to agree to reimburse CHWs for their education and their different work that they're doing through Medicaid. And a lot of the patients they're going to see, not all of them, but if they're in that sector where they're working with Medicaid patients, they're going to be able to get reimbursed. And it's $60 an hour. It's pretty good money. So if somebody wanted to hire a CHW into their facility, they could pay for their salary alone just by the reimbursement they would be getting through Medicaid. And other states that have been doing it forever, like Massachusetts, they were calling saying, how did you guys do this? How did you guys get Medicaid to work with you? We can't do anything with the state Medicaid office. And really what it comes down to, and you being in South Dakota, you'll know this more as you kind of get out into the work world. We're a small state, not area-wise, but population-wise, about 880,000 people. We have always had to deal with a little. we make a lot out of a little. We never get a lot of funding because funding on the federal level comes from per capita. California, Texas, big states, Ohio, they get all the money because they got the population. So we always kind of make do, and we're really good at resources sharing, partnerships with other groups. So it was not a big deal for us to be able to say, hey, we want you, DSS, Medicaid, involved in this. And they were like, yes, we get it. We see it. We'll do it. We'll make it happen. So I'm kind of proud of that we really saw the end game, and we're ahead of a lot of other states that have more resources and more money than we do. Okay. And like I said, salary range is pretty good. We're doing really well. The more patients or clients you see, the more money you can get reimbursed. So even if somebody was working 40 hours a week, a CHW, and they were seeing Medicaid patients, they would have maybe 2 full days of seeing Medicaid patients. They would pay for the whole week. So it's pretty good money. Okay. So again, kind of going through this, these are the things that we're seeing. We're going to be dealing a lot with people that are going to be living in poverty, people without insurance. And that's why we're navigators, to get them into these different systems. I have like I said, 2 students right now that are not from this country, but they love their population that they're dealing with. And we need those people. And that's the thing with CHW is we're not looking for the person that came right out of high school to be 18, 19, 20 years old to be a CHW. You need to be that person that knows your community. They know you. You have been in that area for a while. You understand things. You have a little, understanding of the work world and a little experience. So right now, my students are ranging probably about 26, 27, 28, all the way up to the mid 50s. That is the range of students I have, because they're kind of picked by the entity who's hiring them to work into these different areas. And so, you know what, in this area, working with HIV patients, it's probably not going to be a 25-year-old female. Okay, it's going to be maybe a person who has HIV, a male or a female that might be a little bit older, that has some experience and understands things. So definitely they're the guru of health education, health promotion, but also connecting you to those services. Okay, now we also have them not only just kind of working in the community, but we have a lot of them working in the clinical sector. I have one student right now, he's actually paramedic. He's paramedic certified, and he's also working in the emergency department at Avera, and he's going to be the CHW. How many people come into the emergency room that don't have health insurance? A lot. When you come here to this country, or if you are living in poverty and do not have Medicaid, you're not on Medicaid, you have no insurance. What happens when you're sick? You don't know any better. You go to the emergency room. They have to treat you. You know how much the emergency room costs. It's so expensive, so expensive. So my story I want to give you is we had a CHW. She kind of gave us her story, and she's already working in the state. She was working with the people in the emergency room, and the docs there said, and they'll come in and kind of just meet people and be like, hey, do you need my help? Can I help you with anybody, a patient that you see, maybe somebody that I can follow up with? And those emergency docs said, you know what, we have, and this was in Madison, we have this one gal who keeps coming in. She comes in probably once a week. Her problems are very minor, nothing that she should be here into the emergency room. We spend the time, the amount of money that it costs, and that takes away the time and energy from other patients that absolutely might need the emergency services. Besides that, the cost is very high. So they said, hey, if you could do something for her and us, that would be great. The CHW said, sure, no problem. She called the gal up and just said, hey, I am your local community health worker. I would like to talk to you. Is that okay? And the gal said, no, I don't want you to come to my house. And the CHW said, that's fine. I don't have to come to your house. We can talk over the phone and just kind of go through things. And all in all, kind of through this, she found out that the woman was a hoarder. And she was very embarrassed that she was a hoarder and she didn't want people in her house. Well, they had a good relationship over the phone and ended up that she did invite the lady over to her house. The CHW was no problem, didn't look twice at all the piles of stuff, just concentrated on her, the client. Well, the client had a lot of issues with UTIs. She had urinary tract infections, and she was also almost not even lucid anymore, because when you have that infection, especially urinary tract, and it goes unchecked, you're almost at a point where your body has sepsis, and it starts to kind of affect all of your kind of sensory cognitive. So she was a little bit kind of addled anyway with having this kind of almost sepsis infection in her body. Well, the CHW found out that the poor woman didn't even have plumbing that worked in her house. She didn't have a bathtub or a shower that worked, and thus was not cleaning herself well enough, thus the UTI. So she got somebody over, a local plumber came over, fixed it, got all of that taken care of, no cost to the client, and then started talking to her about how we can eat better. What do we do about when we have this problem? Hey, we need to go to the primary care clinic instead of the emergency department. You need to find a primary care physician or nurse practitioner or PA who can help you, and then you can go to them and have a relationship. So just something so simple like that. Those are the ways that the CHW connects your patients back into the services they need. And a lot of times, a lot of people will think the community health worker is a lot like the social worker. In a way, they are. They're going to get to be very friendly with their clients. They're probably going to share things with you, of course, that you should not be telling other people. You're going to have a relationship. Plus, you probably have already lived or been around that community for a while, so they already know you and, feel comfortable with you. Also, community health workers, we make sure that they have, CPR. If they want to get further into it, they can get advanced life support. They know first aid. So if something happens in their little community, say it's in Murdo, South Dakota, or Martin, they'll be able to put a tourniquet on. They'll be able to do CPR. They'll be able to do, Heimlich and, kind of the easy things, help somebody if they get bit by a rattlesnake. Any of these kind of first aid kind of emergency things, they'll be able to help that person before the paramedics come in to take over. Okay. I'm not going to get into financing because I'm probably thinking I'm almost over my time. But more or less what I had told you on the financing is we have really gone out of our way to put these CHWs in all of these different sectors within health and wellness and safety, human services in the state. And once we showed them that model, that if they were on Medicaid, that even if they had that return on the investment, that their patient was going to be able to be seen and be helped, they realized the return on the investment was going to be really high with the community health worker. And so far, everybody's been on board with it. So I will stop there. I could talk forever. If you wanted to talk about public health, we could go another couple of hours, but I will stop there. And if anybody has any questions, please ask.
Angela, thank you. This was really insightful. I think the biggest takeaway, at least for this group, is it sounds like a new concept. CHW sounds like it's new, but it's not. They've been around. They, like Angela said, they do some of the same duties as a nurse and a social worker. We're just promoting them and integrating them a little bit differently now that all of the health systems and the state and these little towns are on board.
Right.
So it's why we wanted to focus on them to kick off, because you will start hearing the acronym and the term more and more as you get into your career. And even if you don't stay in the state, which ideally we want you to, you're going to interact with these professionals wherever you are at.
Yes,
Um,
definitely.
Angela, will you go to your slide 15?
Slide 15, yes.
Just to show kind of some of the core competencies, scope of practice. I thought this slide was really interesting because, I mean, you look at the social worker, critical thinking, diversity, human rights, social justice. Ideally, this community health worker will have an idea, since they are ingrained in this community and they do understand the clientele, or I mean, in public health, community means so many different things,
Yeah.
but the community, they understand that knowledge and are able to apply those skills to this.
Right.
There's quite a bit of overlap, but obviously the education and training is different.
Right.
One thing from our side with the AHECs, we're starting to work with Horizon. Angela, do you have any
Yep.
Horizon healthcare students?
No, but we know of some CHWs that are already there and that are coming up. Horizon will have some students, yeah.
Yep. So we have, we've actually just started our conversations with Horizon on how we can partner to help promote community health workers as a whole, but B, also within our community. So my office is in Yankton. How can I work with the Horizon Healthcare in Yankton, but also understand that they serve clients from Wagner and Tyndall and Scotland and
Mhm,
Charles Mix County, all over,
right,
coming to this community, whether they live in Yankton or not. How can we as an AHEC, as a healthcare nonprofit, public health educators, promote this as well? So within public health, within community health workers in the state, it really is a partnership and a promotion. I'm still learning about CHWs. It is something that, like Angela said, HRSA gives us our money. HRSA is, and I always butcher this, is it Health or Human Resources and Services Administration?
Health Resources Services Administration.
Okay, I always get it wrong, and I don't know why. I've been saying the acronym for 8 years. But
That's all the Health and Human Services is acronyms, yeah.
yeah, it's crazy. But basically, so you guys have some understanding, we as AHECs have been told we have to work with community health workers. So by having Angela on for at 7:00 at night on a Wednesday, we're checking this off our list for the year to telling her so that we have worked with the community health worker program. So it's a dual positive, I guess, for us.
Yeah. And I
Lillian
need to
did
get the
have a-
word out. Yeah.
Yes, get the word out. Lillian had a great question in the chat. She asked if Southeast Tech was the only program that had a CHW training program. You're not. Lake Area has another.
Lake Area Technical up in Watertown has had a CHW program for a while now, probably since around 2015, 2016. But they first had it as an associate degree, a diploma degree. And from what I had heard, and this is not anything against my lovely colleagues at Lake Area Tech who are wonderful, please do not spread this around. What stays here stays here. They only had 3 graduates in this whole time frame, because people don't really want to be a CHW and sit into school to be a CHW. This is something where you already probably have some experience in healthcare or social services, social work, something like that. And you're picking this up as kind of a cross training, or maybe moving on to it. Now, some of the students I have are LPNs, RNs. I have a bunch of people that have bachelor's, and I even have a gal with a master's degree in social work, but she wants to cross train as a community health worker. And so as soon as Lake Area Tech made it a certificate program, 1 semester, they got a lot more people. And now Southeast Technical College, we just started this summer. I kind of came in around June, July, and built this whole program over the summer. It's still like every day I'm kind of like, what the heck's going on? And it's just a semester. I'll have a whole new crew in the spring, but that's how quickly Avera's and the Monuments and the Sanfords and the clinics, the Horizons, want us to turn out these people. And what's happening right now is, because we have a lot of grant funding.
Right.
So, and I don't know if you know this, but the state got $9 billion of COVID money back in 2020. We're still trying to figure out how to spend it. We're like Oprah. You get a car, you get a car, you get a car. We're just trying to spend that money. Well, part of that from CDC and HRSA was about a $34 million bump for CHWs. And so right now, all of this is kind of grant funded. The businesses, the Averas, the Sanfords are getting money to hire a person who is getting trained in this one semester, 16 weeks, to be a CHW. And then they're going to turn around the next week after they get that certificate and graduate and start working as a CHW. So every one of these students I have, they already have a job. They're in their job, and their job pretty much during the week right now, 40 hours a week, is doing my courses for the CHW certificate. So that's how important. And, hey, it doesn't help to kind of, incentivize them and give them the money, but they are seeing on a large scale, like, gosh, we need this.
Mhm.
We need somebody, a CHW, in every one of these little communities where we don't have a clinic or a hospital or a pharmacy. We need somebody there.
Mhm. And I think you make a very valid point. It's something Michaela and I have even talked about prior. We've had a few meetings with Horizon, CHAD, which is the
Yep.
They're
Community
an organization.
Healthcare Association of the Dakotas.
Thank you. I was going to have to look it up. As well as with the Center for Disabilities at USD, of a lot of the ideal candidates for CHWs are those people that can be cross-trained.
Yes.
I think of, at least in the Sanford realm, that's where my husband used to work, as a patient access representative. It's basically registration and check-in. But if you think about, someone calls on the phone and says, hey, I have this issue, or I haven't been seen for my diabetes and my foot hurts and I have an ulcer and I
Yeah.
don't know what to do. That patient access rep is that community health worker in that
Right.
standpoint of, do you need to go to the ER? Do you need to come into the clinic? Or are there other opportunities and resources that we can
Yep.
help connect you to before you utilize, with your example in Madison, the ER department?
Right. Exactly.
We did get another question. Are individuals training to become CHWs placed in a specific community once completing the program, or is it up to the individual what community / where they will want to work?
Yeah, and again, just right now, they already get the job. They already
Mhm.
have a job, which is nice, right? You already know you
Mhm.
got the job and they want you to be a CHW.
Mhm.
So right now they're getting the job and they already know where they're going to be placed. Now, that doesn't mean like after, 3-4 years of working in one place, you can't leave that business. It's not like the Army where they pay for your school and then you're stuck having to work for them for 4 years. You obviously can go somewhere else, but they're putting that investment into you to be this CHW. And I would think, maybe if you were totally loved it, and like this one gentleman who's one of our students, he's going to be working in the emergency room. If he got sick of it after a while, he could go and be a CHW in another community that he, might have some akin to. So
From
yeah,
our knowledge at this time, a lot of the CHWs, and I mean, at least in the conversations we've had outside of what Angela and Michaela and I have talked about, the CHWs that are going through the programs or who are CHWs at the moment currently have a job and are those cross-trained individuals
Yep.
within the healthcare system or healthcare clinic. It's
Mhm.
not to say that you can't decide to go through the training. I mean, I could go in, I've been in Vermillion 12 years. I mean, I probably could go through the training if I wanted to, but I could think there's a semi-retired individual who volunteers for Salvation Army, United Way, and the food
Yes.
pantry who might be an ideal candidate to be
Yes.
that person.
right.
And they could solicit themselves to Sanford Vermillion and say, hey, I've been here for 45 years. I'm a retired teacher. I
Yep.
want to be more ingrained. I want to do this. Would you hire me?
Yep, for sure.
Ideally, that could be that person.
Right.
There's no right or wrong, but we want people who are CHWs or want to become those. Ideally, they have some lived experience.
Yeah,
They
right.
understand
right.
the community.
Yeah.
They're not the 18 to 25-year-olds.
Right. Yep, exactly. Now, the youngest person I do have as a student, they're transgender and they're actually working for a transgender rights group. And
But
they're
that's
going to be,
perfect.
yep. And they're going to be the community health worker for that
Mhm.
group. And they're in Sioux Falls.
Yeah.
So, yeah,
It's a population that needs
Yep.
connections. Mhm.
right. And we might not have a big transgender group in, Wessington Springs, but in Sioux Falls you do. Yeah.
It's connecting. They're really the connection, like your first slide looked like, the bridge and the connectors between the community and the healthcare systems.
Right.
If that's what you take away, then that's what you take away.
Yep. Yep. Exactly.
Perfect.
Any,
Awesome. Any other questions before we hop off?
did I get some more chats or is that, did we
Nope,
get
that
them
was
all?
just a thank you.
Okay. All right.
Well, Angela, I super appreciate you hopping on. It's so good to see your face, and I know I'll see you here in just a couple weeks.
Yes.
But thank
yes.
you for taking the time out of your evening to share some insight and some expertise, not only into the public health healthcare field, but into CHWs as well.
Yes, exactly. And please
Perfect.
share my information. If
I will.
anybody has questions, you can reach out to me.
I will. I'll certainly add it to this webinar, or I'll put it in our kind of our newsletter if they've got questions to reach out.
Okay, perfect.
Awesome. Thank you, everyone. Have
Yep.
a great night.
Thank you.
Bye.